Hey there, healthcare heroes! Did you know that healthcare-associated infections are one of the leading causes of patient complications worldwide? But the good news? Most of these infections are preventable with the right precautions. Today, we're diving into the best practices for infection control in healthcare settings, from hand hygiene to isolation precautions, to keep patients and staff safe. Let's get started. Infection control is critical in healthcare to protect both patients and staff from healthcare-associated infections, or HAIs. These infections can spread quickly in medical environments, leading to complications, longer hospital stays, and even fatalities. That's why strict infection control practices are essential. So, how can healthcare workers prevent outbreaks and ensure a safe environment? Let's go through the 5 essential best practices for infection control. Standard precautions are the first line of defense against infection. This includes the proper use of personal protective equipment, or PPE, such as gloves, masks, gowns, and eye protection. The key is to use PPE correctly and consistently. For example, gloves should be changed between patient contacts. Masks and eye protection are needed when there's a risk of splashes or sprays. Gowns should be worn to protect clothing and skin from contamination. Always follow your facility's guidelines and remove PPE carefully to avoid contamination. Hand hygiene is the single most effective way to prevent the spread of infections. According to the World Health Organization, there are 5 moments for hand hygiene: before touching a patient, before clean or aseptic procedures, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. Using alcohol-based hand sanitizer is effective for most situations, but soap and water are essential when hands are visibly dirty or after contact with certain pathogens like C. difficile. Next, isolation precautions prevent the spread of infectious agents. There are 3 main types: contact precautions for infections spread by touch, like MRSA. Staff should wear gloves and gowns. Droplet precautions for respiratory infections like influenza. Masks are required as droplets can travel up to 6 feet. Airborne precautions for highly contagious diseases like tuberculosis. N95 respirators and negative pressure rooms are necessary. Always follow proper isolation procedures to prevent cross-contamination. Lastly, cleaning and disinfection are crucial for breaking the chain of infection. High-touch surfaces, such as bed rails, doorknobs, and medical equipment, should be cleaned and disinfected frequently using EPA-approved disinfectants. Follow the manufacturer's contact time recommendations for maximum effectiveness. Regular cleaning schedules, checklists, and audits help maintain a sterile healthcare environment. Infection control isn't just about protecting patients. It's about keeping healthcare workers safe too. By following standard precautions, maintaining hand hygiene, using isolation precautions, and ensuring thorough environmental cleaning, you can significantly reduce the risk of healthcare-associated infections. It takes teamwork and consistency, but together, we can create safer healthcare environments for everyone. That's it for today, healthcare warriors. If you found this helpful, hit that like button, subscribe for more tips on infection control and patient safety, and drop a comment below. What's your go-to infection prevention strategy? Let's share and learn together. See you in the next video.